Hey class, good afternoon. We are covering chapter 24 in your medical surgical nursing book, Care of Patients with Peripheral Nerve and Degenerative Neurological Disorders. This is a very interesting chapter. It goes over various disorders in neurology that you're going to be confronted with in your nursing career. As I'm reading through this, I know several people who deal with these degenerative disorders or neurological disorders and are going through life with them. And I'm going to try to send you some case studies and videos to look at as we work through this. But the first disorder that is mentioned in this chapter is Parkinson's disease. And I'm sure as you've been taking care of your patients in your long-term care facilities that several of you work at, that you have been encountered with a patient with Parkinson's disease. And your chapter talks about, as far as prevention or slowing the progression of Parkinson's, coenzyme Q10 can be an important supplement, ester C also. So just wanted to bring that up. And I'm going to try to start looking at preventative things as we go into these topics as well. And Parkinson's disease, it ultimately affects your balance and coordination in your patients. It is a progressive disorder. It affects more men than women. And there are three major signs and symptoms of Parkinson's disease. First being tremor. It is decreased during voluntary movement. And your book talks about tremors. If you read through this chapter, be sure and read through that. Also bradykinesia, which is slow movement in speech. And rigidity, in your more advanced patient, they're going to have an appearance of being stiff, mask-like without expression, slow movement, slow speech, and degenerate from there, and even end up with some intellectual disabilities, inability to carry on a conversation. And in this patient, there is a slow degeneration of dopamine-producing neurons and the presence of Lewy bodies in the brain, ultimately affecting balance and coordination. There is not a ton of information as to why this happens to a person. It's mostly unknown, but it's associated with head injuries. And the MRI for this patient will show a reduced uptake of dopamine in the bloodstream. Okay. Toxins also associated with toxins. When you're talking about dopamine, I remember as a nursing student, it may not be hard for you to remember, but it was hard for me to remember dopamine. Oh my gosh, is it good? Is it bad? What? But you want dopamine in your system. Dopamine is good, okay? So think of your body as needing dopamine to prevent certain neurological disorders. So dopamine is positive. You want dopamine in your system. So treatment for Parkinson's disease. There's lots of medications, several medications on page 555. And they're aimed at reducing the rigidity for the patient and reducing tremors. And if we had time in class before, I have shown briefly a little clip from the Disney movie Up. I don't know if you've watched that movie. Obviously it's a cartoon, but you can see the slow shuffling gait or walking of this main character that loses his wife. It's very sad. And he's down and he's bent over and he's shuffling. But I have shown that before because that is what your Parkinson's patient looks like. Drug therapy for these patients, you have to be careful. When you have a patient who is taking medications for Parkinson's, just kind of perk up and have your pharmacist number on hand. Remember, I've told you that's a very important number to keep on the back of your name badge all the time, because you need to be concerned about drug interactions. There's a lot of interactions with the medications for Parkinson's, particularly cautioning on foods containing tyramine, and that is aged cheeses, anything fermented, smoked, some imported beers, wines, foods like that. Also, big drug caution with Demerol or meperidine and taking an MAOI for Parkinson's. So be sure and know that there are some drug interactions, and you've got a caution box on page 555 also. With Demerol, it can cause heat elevation and possible death for a patient who's taking this MAO inhibitor drug for Parkinson's. And your drug therapy, it mainly is divided into sections on anticholinergics, dopamine agonist. Remember, a dopamine agonist adds it on, helps it out, and MAO inhibitors. So many drugs interact adversely with MAO inhibitors, and the patient should consult a healthcare provider or pharmacist before taking any other drug with an MAOI. All right, nursing management of these patients. Obviously, they're rigid, they're slow moving, slow speaking, they drool a lot. So you have to think about things like skin breakdown,